What causes bladder pain after radiation treatment? Imagine undergoing radiation therapy for cancer in the pelvic area and then experiencing ongoing bladder discomfort long after your treatment ends. That's because radiation can sometimes cause changes in the bladder that lead to pain and other symptoms. This condition is called radiation cystitis, and it happens when high-energy radiation beams used to target cancers like prostate, cervical, or bladder cancer inadvertently damage the healthy cells lining the bladder. The bladder lining is normally protected by a mucosal barrier that keeps irritants and bacteria out. When radiation hits this area, it causes injury and inflammation to these cells. In the short term, during or right after treatment, this damage results in what's called acute radiation cystitis. Symptoms include bladder pain, a burning sensation during urination, increased urgency and frequency, and sometimes blood in the urine. These symptoms are usually temporary and tend to improve within a few months. However, radiation can also cause long-term changes. Months or even years after treatment, some people develop chronic radiation cystitis. This occurs because the radiation damages the small blood vessels in the bladder wall, leading to reduced blood flow, tissue scarring, and fibrosis. Over time, the bladder becomes less elastic and more stiff, which can cause persistent pain, ongoing bleeding, and urinary problems. The bladder's ability to stretch and contract properly may be impaired, leading to discomfort and other complications like infections or ulcers. The severity of bladder pain after radiation depends on several factors. Higher radiation doses and longer treatment durations increase the risk of tissue damage. Radiation can also affect nerves controlling bladder function, leading to symptoms like urgency or pain due to nerve injury. Additionally, damage to the protective gag layer of the bladder lining makes it more vulnerable to irritation and infection. In essence, bladder pain after radiation treatment results from a combination of tissue inflammation, blood vessel injury, scarring, and nerve effects caused by radiation exposure. While these changes can be challenging, many symptoms can be managed with medical care focused on relieving discomfort and protecting bladder health. If you experience bladder pain or urinary issues following radiation therapy, it's important to consult your healthcare provider. They can evaluate your condition, offer personalized treatment options, and help you manage symptoms effectively. Remember, individual experiences vary, and proper medical guidance is key to maintaining your bladder health.